Okay, this morning we're doing super duper easy codochromes. Alright, let's get started. First here.
This maybe a red little
What?
papule.
I can't hear you.
Maybe
Louder?
Pustule, papule, I don't know.
Okay, we're going to throw it back to the back of the room. Marge, what do you think?
I can't quite see. Well, when I was reading McKee's, I read a lot about red papules, but I think I'm gonna toss it back.
Okay, we'll give everybody a new clue. It should be pretty obvious now. Matt, any ideas?
That's EKV, 30.3, EKV.
What?
Close, but no. Kevin?
I think about this when I used to go to Camp Wonder. There was this kid named Moochie.
Wait, what
this
was
is
his
called-
name?
His name was Coochie. And he had papules all over, and we used to go on hikes to the lake, and he would say "Coochie, Coochie, Coo" to this other kid, and so Coochie, Coochie, Coo. I think of my coochies, which I think is that's what this is.
Yes, correct! My Gucci's! John, do you have anything to add?
Yeah, so the way I like to think about this is, you have Mafuchis and you have Kikuchis and
Wait, what
two.
was that?
Marge, get out of the cone of silence. Just as I was saying, two of the Kikuchis and one of the Mafuchis. Now you have my coochies. It's 4, and that 4 goes with M, so it's my coochies.
Okay, very good. Marge?
What?
Pumping. God, I need some staff. PP. God, I need some staff. Where is everybody? Oh, God. PP. Is there a potluck? Dr. Sulit. Sir, I can't find any staff. I need to staff a patient. I have a 57-year-old female that needs this laser done on this vascular lesion on her face.
Oh, but
Can I staff
I don't know
with
if you did you get my email? We have a potluck today. Decided yesterday we're having another potluck, so I'm busy. I'm
I
sorry.
can't find any staff, sir.
Well, why don't you sit down and maybe for a minute?
Okay, sir.
Okay.
My patient's waiting, but maybe you
Okay.
can still staff.
Okay. Because there's 3 things that I think really bring people together, and that's food, people, and food. Will you please sit down? Thank you. I like potlucks. Here, you have to eat some of this.
Oh, okay.
You have to eat. And have some of this. Thank you. Oh, something just came up. I have a meeting. So I can't staff your patient, but I want you to leave you with this. Make sure you've completed Uncle Sam's OPSEC and Cyber Awareness Challenge by the end of the day. That's all. Attention on deck.
Call me Megan. Call me Megan.
Okay, Dr. Seago.
I said call me Megan.
Okay, Dr. Megan. Oh, stop hitting me.
I guess I'll go find Dr. Gibbs. Captain Shoemaker, are you in there?
Yeah.
Hey, Captain Shoemaker. Can I staff with you?
Oh, hey, bud. Yeah, come on in.
Sorry if I'm disturbing your pee time.
Yeah, it's Big Peter time. I'm Big Pete. Big Pete Shoemaker.
That's cool, sir. Hey, sir.
Where's Lilia?
How are you so chill all the time?
Well, I'll let you know my secret.
Is that milk?
No, it's a pina colada, actually. Will you go get Lilia?
Sure, sir.
Thanks. Lasers. I got some laser cases, actually. You might want to look for someone else. Yeah. Pina colada. It's not a virgin.
Alright, is everybody ready? Okay, but hit the music. Alright, we're gonna go fast and furious. Here we go. Alright, first thoughts first. Anybody? Anybody?
AFX.
No, you're wrong. Screening lupus dermatitis. This is pH or plus. If you're 80% of the way, you're 100% of the way there. Here we go. Everybody in focus? Alright, here we go.
Is everyone in focus? I'm not in focus.
Yeah, Margie, you just give up.
No, wait.
Yeah, again, this is,
Okay, there we go.
it's the same darn thing. pH or plus. Alright, here we go. Alright, got it? Everybody got it?
I actually have a differential for this. Wait, from the keys.
Come on, Margie.
Let me just pull it up here.
You get 10 seconds to slide.
Oh, Kevo, what was that?
Alright,
Okay.
tell us in it. Keep moving. Here we go. Kevo, what you got, man?
Alright, bro, this is a little more LSNA. Nice try.
Alright. Getting there. Let's end on a good one. Anybody? It's a bug bite, people. It's a bug bite. Okay. Matt, why don't you read these people? I don't think I'm getting there.
Alright. Just make sure it's in focus.
How do I do this thing? Alright, first I do this. Nope, I do this. Then I do this. I do this.
It's not in focus, Matt.
I do this.
Dude, flip the condenser.
Oh, shit. This it? Is the condenser? This is it. No? This?
That's a little better.
Yeah, okay. Do you see the arrow?
I don't think you have the arrow on.
Oh, that's not the arrow, see then.
That's a hair follicle.
Yeah, that's what I meant. Hair follicle. Good job. Alright, next slide.
Hey, it's Tom Landers. Yeah. Does it hurt? Okay. Well, give me a second. I've got a resident here who I need to staff, and then we'll call you right back. Okay? Sounds interesting. All right. Talk to you then. Yeah.
Hi, sir. Do you have a moment to staff a patient with me?
Sure. Yeah. I think got some time. Come on in. Grab a seat.
All right.
So what you got?
I've got a 63-year-old male who's had this 1-year rash that all started with his mouth, and now it's more eczematous, just also peeling on the palms and soles. It's just taken on this long, complex course that
Okay.
he's tried everything.
Okay. Okay. Yeah. Let's take a look here. So, what do you think what would you say the rash is? Like, what do you think is the most likely diagnosis?
I mean, there's always contact dermatitis with the mouth. It's nutritional deficiencies, but I feel like he's been through the ringer with that workup as well.
Okay.
We're trying to rule out malignancy.
Yeah. So it's in the mouth. It's on the
Yes.
skin. So, I mean, LP. We should be thinking about LP. So, actually, all right. Let me get there. So let's take a look here. So, we got LP. So, certainly, we want to consider getting a biopsy today. We'll approve that or not. That'll help us out with defining what that might be. And then obviously treatments, we've got steroids and lots of other options here. But why don't we take a look, and then we'll see if we want to get a biopsy, better kind of figure out if that's what this is. Okay, so let's go take a look at that patient.
Sounds good, sir. He's just in a gown.
All right, let's get some hand sanitizer out of you. That's good. I'll let people know that we're washing our hands. Hey, how's it going? Tom Landers.
How are you?
Hey, Cody, I'm glad to meet you. What do we got? What's been going on today?
I got this little nodule on my arm.
Okay, yeah, let's take a look there. You know, I agree. I think we're gonna get a biopsy, okay, today.
All right.
Pretty low risk. She'll tell you all about it, and we want to figure out if this is which type of rash this is before we start treatment. But a little punch biopsy today, and we'll get that going. Okay. Any questions at all?
No.
Okay. Well, you're in good hands. Okay.
Thank you.
Good to meet
Appreciate
you.
it.
Dr. Feldman, can I staff my surgery patient with you?
Well, the P indicates I'm eating my pie right now.
But Dr. Feldman, I have a 32-year-old gentleman with a 5mm
Please sit down,
subcutaneous nodule on his neck. I think it's an EIC, and we have him draped and numbed. I'm ready to begin the surgical removal.
You're
If
not
you can-
behind, are you? Because I have lots of time to talk about this excision of an EIC.
Well, sir,
Tell
I do
me
have
more.
2 other folks that are on my surgery today.
His heart? His
He's-
lungs, are they okay?
He's a young gentleman. He's in pretty good shape.
And he has 6 to 12 months to take it easy so this can heal well? Otherwise, I'm not sure we should do this.
I believe he's going out on the Macon Island in about a week.
And you said just assist, huh?
It's just a small,
Just assist.
small, it's,
Okay.
sir.
Okay. Have you met my friend here before? This is Mr. Talk You Out of doing just assist.
It's got a punctum and everything, sir.
So this cyst is here, huh? Do you need the magnifying glasses to see?
It's,
Oh,
it's
Jesus.
kind of in this region of his neck.
Now that may be a danger zone. Where are we here?
Well, I think there's an Erb's point near there. I wanna
Right,
look for
spinal
there.
accessory nerve, okay? So P, I'm gonna finish eating my pie, and you're gonna send that to ENT.
Yes, sir.
Okay.
Anyone, it's her last patient. See if Dr. Gibbs is here. Oh, it's dark. Hi, sir. Are you available to staff my last patient? I can't find anybody else.
Well, you can see I'm pickling. Can you see if any of the girls are available?
Sure, I'll check one more time, sir.
Thanks, Maurice. The filler in the face have really fixed that volume loss. I'm still having a good bit of volume loss a little bit down here, but I'd rather work
We
right.
can address that.
Good.
Yeah.
I tried the Scrotox. Not quite there yet. But today, I'd really like to work. Let me see the mirror.
Yeah, yeah.
Yeah, so much here or here, but here. Is there anything you can do for this?
Yes. Let me get you some eye
Okay.
probe. Okay, I'm gonna give you these. Why don't you just put those
Sure.
on? Okay. And so if you'd like to improve, now what's this region called again? What was that word you used?
I think it's called the décolletage.
Oh, excellent. Okay. So
Décolletage?
decolletage is good. So I think we could consider some CO2 assisted delivery of Botox.
Sweet.
Is this left over from your Scrotox?
It is. It
Okay,
is.
this is perfect.
I only had to use about 3 cc's.
Oh, good. Okay, so we got 2 to work with. Okay, yeah, so I think we can do that. Now, are you comfortable with me doing this?
Ooh.
I don't know.
Okay, so Mars, tell me what we're gonna do one more time.
Do you have a mirror, Dr. Willett?
Yes.
Okay. I think the main thing is that this doesn't really match this. The face just isn't matching with this.
You've said enough.
Oh,
I got
okay.
you. I know exactly what to do. I don't, since you have the goggles, I'm just going to use this upper, okay?
Oh, that's okay.
Okay,
Can
perfect.
you see what you're doing?
Yeah, don't worry about it. I got
Okay.
you. You ready?
All right,
Here's
here
my
we
first
go.
shot. 1, 2, and 3.
Woo! Wow.
Okay, one more. Next. 1, 2, 3.
Woo! Wow.
Whoa, oh,
Oh, what's that smell? Oh my god, my hair's on fire! Oh my god!
Nothing like potlucks. Nothing like them. They are great. They bring people together. Just like today. Potlucks, potlucks.
Hey John,
Mm-hmm.
do you wanna, it's getting later, you wanna play that game?
You mean our game?
Our game, yeah.
Yeah. Like, what time is it?
I think everybody's left. I think we're probably safe.
Yeah, let's do it.
Okay.
Who's gonna ask the questions?
I'll ask this time.
Okay, cool.
Yeah. Alright. Name the inheritance pattern, bro, for Galley inheritance pattern.
Autosomal dominant.
That is correct. Okay, question 2.
All right.
You're on a roll, bro. Let's go with name the gene defects for Naegeli-Franchischetti-Yadison disease.
Ah.
A 3.
Oh. 5, 14, and 17.
Wow. I like it. Do this again.
Nice. Working out, huh?
Every day. All right. This is for the money and for the pants. Can you name for me the most common presentation of my coochie? You got this, bro.
Erythematous papules. Ooh. No, that's right. That's right. Ooh. Nodules? Come on, man. No. Papulous squamous.
Ouch. Bro, come on, I had more faith in you.
Superficial erosions. Don't stop, man.
Sorry, bro.
Come on, is it erosions? What it? For the love of God, please just give me the answer.